Good morning and welcome to the Wavy Digital Desk. I'm here with Vickie Armstrong, nurse practitioner with Riverside Neurology Specialists. Today we're going to be talking about memory care. We know it's something that affects so many in this community and nationally and globally, and it's something that we can all speak about, and we can all live it from personal experiences. So we just want to get into it. What actually are ways to notice these conditions, to notice memory loss, and also what are ways to support caregivers and support loved ones that are taking care of people in their family or friends that are dealing with this. So Vickie, thank you so much for joining us today.
It is my pleasure to be here. I'm so happy to be here to talk about memory concerns because there are so many questions about memory.
Absolutely. If you would, this is something that you've been specializing in for a long time. Could you just speak to some of your experience and maybe how you even got into this field?
I'm a board certified gerontological nurse practitioner, so my care has always been specialized in older adults. I joined Riverside Neurology Specialists in 2017, and at that time, the goal was to establish a memory care clinic that was specialized in the care of people with cognitive impairment or dementia. So we have been providing that service to the community since then. Um, and my experience has been, significantly specialized for the last 5 years. Also have had, personal experience with family members. My mother had dementia, and so I really feel I have a good idea of not only the professional side but the personal side as well.
And, with your patients right now, what are some things that people might come in and present with or have questions about? Are people coming in because they've been dealing with problems for a long time? Are some people coming in because maybe they've noticed their memory has been lost maybe over a month or two? I mean, what sorts of things get people in to see you all?
It's a great question. So it really runs the gamut. So some people come in because they've noticed changes in their memory and they're concerned. Sometimes their families will tell them that, they're forgetting things or, something's different. So they end up talking to their primary care and then being referred to neurology specialists for further evaluation. The Medicare annual wellness visit has a cognitive screening piece to that visit as well. So that can trigger more questions into what's going on with memory.
And if you're at home and maybe you're either with family members that are maybe aging or friends, I mean, what are some things that you'll notice either as the person maybe with the memory loss yourself or noticing it in the loved one?
So memory loss, it's kind of on a spectrum. So some of the things, um, a very quick example, I tell people it's okay to forget your car keys, but it's not okay to forget where your car is. So it's degrees. So normal aging memory loss happens to most of us as we age. And it happens because as we age, our brain actually shrinks a little bit. And because of that, you can notice changes in your memory. So you feel like your memory has changed. You have to think harder about things. If you're learning something new, it takes longer and you really have to concentrate more. Um, but your daily function is not impacted at all. Nobody else has noticed that you have any memory difficulties. That is the definition of normal aging memory loss and more severe memory loss. So, mild cognitive impairment is when you're forgetful and other people notice it. You might forget conversations, you might forget details of that conversation, you may ask questions repeatedly or repeat yourself to others, um, but you're able to take care of yourself, the business of your life. So, managing yourself, your home, your finances, participating in your social activities, still working, but other people have noticed that you're forgetful. The next kind of memory loss is what we call dementia. And dementia is when memory loss is significant enough that you need assistance taking care of yourself, your things, your belongings, forgetful, forget to pay bills, those kinds of things. Now, those are all functional descriptions of a kind of memory loss. They don't speak to what is causing the memory loss. And that is the important thing to try to figure out why this memory loss is happening, because it could be treated. There are some reversible causes of memory loss, but very important to get an accurate diagnosis.
And in terms of maybe noticing if somebody is missing some long term, is missing short term memory, I mean, does that matter in terms of diagnosing those different levels that you just talked about?
It does. So classic Alzheimer's um, presentation is short-term memory loss.
Okay. And then, you give the example of losing your keys, or, I think a lot of people might wonder where their phone is. Those are some of those things that come to mind. But those things become problematic when they stop you from actually, as you said, finding your car, or figuring out where to go, or maybe figuring out where home is. Are those some things that escalate the situation, and that's sort of when you might need to come to a specialist like you all at Riverside to figure out what the problem might be?
Yes, because certainly figuring out what the problem might be can help in treatment. There are some treatments that are available to help to stabilize memory.
And what I wanted to ask you about too, you said something called mild cognitive impairment, that we spoke about prior to this conversation. Just in a topics, back and forth. But could you explain what that is? Because I think to some people, I don't know if they realize that besides dementia and Alzheimer's, that there are different names for different types of memory loss.
So again, mild cognitive impairment is when you're forgetful and other
Mm-hmm.
people notice it. Now, mild cognitive impairment can be due to things like strokes, Alzheimer's disease, other neurological diseases like Parkinson's disease, or alcohol use, or vascular disease. So the mild cognitive impairment refers to your ability to function. And then the reason that that is happening is this Alzheimer's disease? Is this alcohol use? Is this the late effects of a stroke? So there's many reasons that this can be happening to an individual.
That's interesting. So, and some of those are lifestyle choices, some of those are, genetic and do happen.
Absolutely.
In terms of those, if you present, if you need to go in to see a doctor, I mean, what kinds of tests do you all run to figure that out? I mean, is it brain scans? Is it doing, certain, tests of mobility? I mean, what sorts of things are you doing once you get to an office?
So when someone comes in for evaluation of memory loss, it's a history and physical, talking about the symptoms. When did they first start? What was the first thing that was noticed? And then looking for other things that may be happening that may not be as apparent. So things like behavioral changes, personality changes. Um, and after the history and physical is completed, including a neurological examination of function and reflexes, then usually some kind of imaging is indicated, either MRI or a CAT scan if someone can't have an MRI. And then laboratory studies, making sure that vitamin levels are in place or in normal limits, that thyroid function is normal, because those are the reversible types of metabolic causes that can contribute to memory loss. Psychiatric problems such as depression and anxiety can really impact memory. Um, Depression can mimic dementia if it's severe enough. So that has to be considered as well.
Wow, I mean that's significant, and I think that depression is something that does affect a lot of the population. But then to add that in as a possible cause for to memory, I mean, is that something where perhaps theoretically, I know we can't speak patient to patient, but if someone went on antidepressants or maybe found ways to work through their depression, that memory could be restored, or some of those, is it irreversible occasionally?
So if it is if memory is being impacted by depression and anxiety, certainly treatment of those medical conditions can really make a difference in cognition. Um, you know, I give the example that if someone has depression or anxiety, and you've got this constant anxiety noise going on in the background, kind of like white noise, it makes it really difficult for the brain to process information because it's paying attention to something else. Um, Sometimes there are undiagnosed attention deficit disorders. Um, I've had people that have been diagnosed with attention deficit at the age of 70, and they never knew they had it. So it's really important. The other thing that's important, particularly for older adults, is making sure that vision problems are treated and hearing problems are treated. Because if you can't hear or see the information adequately, your brain can't process that information and make memory out of it.
Right. And with that too, I mean, depression as one thing, but then you spoke about some of these others. I mean, these are something that you won't really know until you get in the office. So, I mean, what would you say to people that maybe say, oh, I don't want to overreact. I don't know if I want to come in to the office to get checked out. It's just, I'm just aging. It'll be fine. I mean, would you rather people err on the side of caution?
Absolutely. So it's important for people with any concern about their memory to talk to your primary care provider and get a screening done. Certainly, some of the tests are basic blood tests that can be done in primary care, and have a cognitive evaluation done. We would definitely rather have people come in earlier and say, I think you're doing okay. We can see you in a year, see how things are going. Or if there's concerns, then we need to evaluate that. Many times people they don't want to come in because they don't want to know, and people feel like, well, you can't do anything about it anyway, but that's not exactly true. So, if someone is diagnosed with Alzheimer's disease, there are some medications that we currently use. And then, of course, there are medications on the horizon that are coming that can be used, but they are for early stage. So, the earlier someone is diagnosed with Alzheimer's disease, then, they may be eligible for some of the new treatments coming out.
Right.
And then, of course, clinical trials are always an option as
Mm-hmm.
well.
And those are something I'm sure over your career you've seen develop and different things go through trials and different, advancements come out. I mean, are there some things that you're looking at right now or that, maybe have come in line? I know that Alzheimer's medication, that's really been a focus of some of our coverage here with Stephanie Hudson recently about, different medicines and different treatments that have come down.
hmm So certainly, some of the medicines that we've been using for about 2 decades are certainly an option. We know them well. We know how they work, and it's a good option for a lot of people. Again, the new medications that are coming out, the injectable lecanemab is one of the medicines that um, it's for very early Alzheimer's disease, so not everyone is a candidate. And again, early diagnosis is your best opportunity. And even if you don't want medicine or you don't want to participate, getting a diagnosis is important because one of the first things that anybody that is diagnosed with any kind of cognitive impairment or Alzheimer's disease should do is to be sure that you have advanced directives in place and powers of attorney, because there may come a time that you can't make decisions. So you want to have someone that can speak for you. And truthfully, any adult should have advanced directives and powers of attorney in place because people have accidents all the time. So it's important.
Right. And that's so interesting because that's a reason right there, while it might not be a medical treatment, it's helping your personal life and even potentially helping family make decisions for you in that case and helping them.
Absolutely. And if you find that you have any kind of potentially uh, long-term disease, it is you might reevaluate your life and what you're doing and make different decisions on how you want to spend your time. So it's important to get a diagnosis.
And you said something earlier about, going to a primary care or going to a regular doctor. That's one way
Mhm.
to sort of know what's happening. But in that regard, it's also good to probably have a baseline for things that you spoke about, like your, levels and getting labs done and sort of knowing what it looks like. So perhaps when there is a problem or there is a difference, it's noticeable. Does that make a difference, in helping
Yes,
diagnose?
yes, absolutely. Because the thing that I really look for is change in function, and change in how people act, and so it really is good to have that baseline evaluation.
And, when people come in, and I don't know if this is a conversation that you all have or different people in the office or in the health system, but, when somebody gets a diagnosis, I think it's difficult for them and it's also difficult for their loved ones and their family to digest and to absorb this change. And perhaps they already noticed the change coming down, but this could also be leading to something, more severe, depending on diagnosis. I mean, are there things that you say to them?
Absolutely. So it's important to, even if someone is diagnosed with an irreversible or a degenerative condition, um, certainly helping people be the best they can be for as long as they can be is what we want to do. And I spend a lot of time counseling people to say, look, we can't change what has happened already, but what we can do is help you be the best you can be, and get some of these things done, such as advanced directives and powers of attorney, and then live your best life every day, because that's what all of us should do anyway.
And in terms of supporting, maybe you're not the one taking care of the family member or loved one with memory loss, but if you need to support caregivers or support, even maybe perhaps if you have help, at home. I mean, what are some things that you can do to sort of help the situation or offer support? I mean, is it just good to be around the person that is having difficulty? Is it good to give the caregivers a break every once in a while and say, I can step in and do this for, a day or two? I mean, what are some of those things that you might have heard about?
So safety for people living with cognitive impairment or dementia is really important. Um, and one of the so home safety, making sure that the environment is safe. Um, you may need to unplug the stove if the person living with cognitive impairment is living alone, and there can't be a caregiver there 24 hours a day. um, so certainly building your care team of others, because many times, and most of us know this from personal experience, a neighbor or a friend will say, well, let me know if there's anything I can do to help you. And one of the things we counsel people is to have that list of things that you need help with, so that when someone says, let me know if I can do anything to help, you can say, oh, that's perfect. I need help doing, you know, A, B, or C. and it may not be something that everyone can do. Not everyone's comfortable being a companion for someone that has, significant memory loss, but there's other things that they could do. So having those things identified beforehand is really good. Getting connected with the Alzheimer's Association and the caregiver support groups that are available through that organization is really important as well, um, because it can help to know that you're not alone. And listening to other caregivers talk about their issues can help you solve some problems as well, because people in support groups learn from each other as to how they solve a problem.
Right. And I think, sometimes the easy request, right, is, oh, yeah, sure, you can bring dinner over or something. But sometimes you need something more substantial.
Mhm.
You can make dinner, you can figure it out, but you do need somebody, as you said, if they are capable to sort of take on another level.
Mhm.
And I did want to ask too, when you get the diagnosis of memory loss, or you maybe are in a situation where you need some more help, or things like that. I mean, how important is like stimulus every day? Getting people around you, not being alone for so many hours in a day, whether it's watching a little TV or reading a book or having a pet. I mean, how important are having those things in your life?
So, activities and socialization is really important for older adults. And of course, during the pandemic, when everyone was more socially isolated, we definitely saw people had cognitive decline that we didn't really expect. So, it is well known that people need that activities and socialization. So, um, and even if someone can't actually perform something, we tell people it's more about the process and not the product. So, in other words, if you're visiting with someone that has a memory problem, playing a game of cards, it's not about who's winning or losing. It's just about maybe matching the color, matching the symbol, or just spending time and conversing with a person living with dementia.
And similar to that, but in more of a physical sense, if you do have memory loss, but you can still be active, your body is still, healthy and good condition. I mean, you still need exercise even though perhaps your memory is going as well, right? You don't want to just sit even though that's maybe the easier thing to do.
Absolutely. So think of the phrase, what's good for your heart is good for your brain. That's very, very true, because all of the activity that can help to reduce cardiovascular risks can help to reduce vascular damage in your brain as well. And also that old phrase, use it or lose it. It's very, very true. So, um, you know, it's very important to get some daily activity in the company of others. Take a 15-minute walk. Um, so just any of those things that you can do, and then old hobbies. If you can continue to do those or resume doing them, maybe with the help of somebody.
And one of the last things I wanted to ask you is, we've talked about, what kinds there are, some of the reasons behind it, some of the ways to help, but in terms of, if you are not elderly yet, or you're not in that stage of perhaps maybe having memory loss. I don't know if there's people in your family that do, or what the situation is, but are there ways to prevent future memory loss, or does that, I mean, that might range, that might depend on exactly what the problem might be, but is it just staying healthy and, keeping your brain as active as possible as you get into maybe retirement in some of those years?
Mhm. Absolutely. So one of the best things you can do for yourself is don't smoke, limit alcohol use, and then healthy diet, exercise, and staying socially active is really important. And many people are working past retirement age, and it helps people to keep socially stimulated and active.
And I think those are good, tips and ideas, because I think so many people, I mean, you know, that are maybe in that stage of having less movement or being less active, maybe they can't drive to a certain point, or they're having difficulty walking around. I mean, you do lose the aspect of socialization in your community or maybe at the workplace, so now you're
Mhm.
trying to find ways to supplement that.
So, and one of the good things I think that has come out of the pandemic is the ability for people to participate in online activities. So, um, online at home exercise is available, and some insurance companies actually will have programs that they can enroll you in that. And then again, online caregiver support groups, online learning. So, certainly doing as much of that as you can, um, even with mobility issues. Um, to try to improve mobility issues, there's things like chair exercise and Tai Chi. Um, so that can be helpful even if you have limited mobility.
Absolutely. Well, Vicki, I think that covers a lot of us, at least just scratching the surface of some of these things and just giving some tips of things to look out for, and different ideas of how to continue staying active, whether physically or socially. But is there anything else that you wanted to highlight? I'm sure you could have gone into depth in a lot of these different questions and topics. But is there anything else just for the general community that just would be helpful for them to know from your practice?
If you're concerned about your memory, talk to someone about it, and get an evaluation. Even if you talk with your primary care and they do an evaluation and you do fine, it's that's a good thing. And keep on top of your health, making sure that you're taking care of your medical problems, because that will go a long way to keeping yourself healthy.
Well, Vicki, thank you so much for joining us today. And this conversation will be shared on wavy.com as well for people to tune in and get some more of this chat in an article, and also find, different resources and websites. But thank you so much for joining us. And, I hope that this touched some people in terms of this being such a community issue for, so many here in Hampton Roads.
Thank you so much for having me. I really appreciate the opportunity to be able to talk about some of the basic issues with memory concerns.
Yes, well, thank you. Thank you for watching. And please, go check out Riverside Health. We've done another chat just a few weeks ago as well. So please keep in touch. And thank you so much for speaking with us today.
Thank you.